A very good morning, all of you. Today, we're going to start with a new chapter in this series of pediatric dental education. We're going to talk about aims and objectives of periodontics and preventive dentistry, its scope, and some other related aspects. I'll just share the slides with you all. The topic for today's discussion, as I mentioned, is aims, objectives, and scope of pediatric dentistry. Now, the content format will be introduction, definitions, history. History is very critical, my dear friends. Then about pediatric dentistry in India, how did it come to India? Who are the involved personnels? And then finally, the aims and objectives, scope of periodontics, present trends in pediatric dentistry, and difference between child and adult patient, and basically the periodontic triangle also. Now, definition given by Stewart, 1982, states that pediatric dentistry as a practice and teaching of comprehensive preventive and therapeutic oral health care of child from birth to adolescence, and it is construed to include care for special patients who demonstrate physical, mental, or emotional problems. So the definition basically covers a lot of things. Okay, and what I would like to stress over here is the stress on special patients. What do you mean special patients? Special means a slow learner. It can be a autistic child, child with cerebral palsy, or any medical condition. So these come in the category of special patients. So they are also included in the scope of pediatric dentistry. Another definition which was provided by Pinkham, this is very comprehensive, and I'll be very honest, the definition is very good, but it is a little difficult to remember. So pediatric dentistry is synonymous with dentistry for children. Means pediatric dentistry means children's dentistry. So pediatric dentistry exists because children have dental and orofacial problems, and the genesis of dentistry for children unquestionably is allied to dental decay, pulpitis, and the inflammation and pain associated with infected pulpal tissue and suppuration in alveolar bone. So he has described it, Pinkham has described it much further and deeper. And now we have a definition by Boucher, who says periodontics is the branch of dentistry that includes having a child accept dentistry, prevention, detection, restoration of primary and permanent dentition, applying preventive measures for periodontal therapy, dental caries prevalence, intercepting and correcting various areas of malnutrition. So he's also covered a lot of things. But the most critical part or important part of this definition is that having a child to accept dentistry, that's where the fun begins. See, periodontics means what is there? Dentistry for children. What is there in that? It is so easy to say. But here he has mentioned, the person of the stature of Boucher has mentioned having a child to accept dentistry. In adult dentistry, what happens? You call the patient, you make him sit, you explain things to him. He agrees, gives his consent, he opens his mouth, and you start with the procedures. You complete the procedure and give the post-operative instructions. Simple. So what is so difficult in pediatric dentistry? There will be many a times where the child is crying at the entrance of your clinic. He's not willing to enter your clinic. So if he doesn't enter your clinic only, what else are you going to be able to do? Will you be able to do anything? No. Now he's entered your clinic. Maybe some children enter your clinic very happily. They're not willing to sit on the chair. Then what will you do? This is the second situation. Now the third situation, he's sat on the dental chair, but he's not willing to open his mouth. Then what will you do? Fourth situation, he's opened his mouth. He's allowing you to do the examination, but he's not allowing you to make radiographs. The moment you're putting the radiograph in his mouth, you're putting the RBG film or the phosphor plate in his mouth, he is showing a gag. He feels like vomiting. Okay, he's allowed you to put the X-ray film in the mouth. And when you're just about to shoot, he moves. If he moves, what will happen? So the X-ray will not come proper. So that's another problem which you will face. Then he's allowed you to make the radiograph. You manage somehow. And then you start with the drilling process. and he suddenly closes his mouth or he starts moving his head. So, right from the entrance till the exit, chalo, you were able to manage everything. Situation 5, came in your clinic, opened his mouth, you were able to perform the procedure. Okay, post-operative instructions is not following. You asked, told him not to eat anything for 1 hour. Outside he goes and he eats something. What will you do? So post-operative. That's why Boucher stress that the child to be, the dentist making a child accept dental treatment is a big thing for him. The definition which I really love, which is simple and easy to learn also, and has got a lot of meaning. This particular definition is also an amazing definition. See, if you notice, every definition that was covered had something special, over there. So now what is special about this particular aspect? So coming back to this definition, pediatric dentistry, as per the AAPD, he says it's an age-defined specialty that provides both primary and comprehensive preventive and therapeutic oral health care for infants and children through adolescence, including those with special health care needs. So this definition looks like all the other definitions, but friends, if you have noticed, every definition has something really significant. Like I mentioned in the previous definition, like when you go to the previous definition, having a child to accept dentistry was the important part. Here, he mentioned about everything, that right from pus in the bone, infected pulpal tissue, he mentioned everything. And the first definition by Stewart mentioned special children also in detail. So every definition had something very, very critical. And this particular definition, it is mentioned about treatment, preventive care, and everything. And it is mentioned about special kids. But the thing which is really impressive, it clearly states in the beginning that pediatric dentistry is an age defined specialty. What do you mean by an age defined specialty? What you mean exactly is that anything and everything in pediatric dentistry is connected with the age of the child. How? I'll give you an example. When you, the various behavior management techniques which are there, which you use for children, for a 3-year-old, the method will be different. For a 5-year-old, it will be different. For a 7-year-old, it will be different. For a 10-year-old, okay, the way you talk with the child, okay, how you communicate with the child will be different for different age groups. You can't talk in the same tone to everybody. You can't use the same explanation to explain to all children. In a 3-year-old child, the air rotor which you use, the drill which you use, you will say it is a water pump or it is a water shower machine. Till maybe till 3 to 5 or 6, it will be a shower machine. Then as the age advances, then you will have to tell them the actual description about, okay, various treatments that you do. Okay, even the treatment plan changes with the age group. In a 3-year-old, in a 5-year-old, in a 7-year-old, or even in a 9-year-old for that matter, you would want to save the tooth. You would want to keep the milk tooth in the oral cavity for as long as possible. extraction would be last in your mind. Okay, you would not don't want to remove a tooth just because it is spoiled so easily, so quickly. You would want to do the endodontic treatment, that is a pulpectomy or the root canal. But in a 10-year-old, if a 10-year-old or 11-year-old child comes and the second deciduous molar has a deep carious lesion, okay, and so would you like to do a root canal? Because in a 7-year-old in a deep carious lesion, you initiated the vital pulp therapy. You did endodontic treatment also at times. In a 3-year-old also you did that, though with a lot of difficulty. In a 7-year also you did that, but in a 10 or 11-year-old, it is very close to exfoliation. So when the tooth arrives in the oral cavity, when it departs from the oral cavity, becomes very, very critical as far as pediatric dentistry is concerned. Then these aspects are very critical. Then the age, again, what are the different types of ages? So there is something called as the dental age. What do you mean by dental age? It is that age, okay, related to teeth. It is the tooth ka age. So when you say what is the dental age of the patient, it coincides with the last tooth that is erupted or erupting in the oral cavity. So for example, you see a permanent central incisors. You see the lower two permanent central incisors. So what will be the dental age of that child? The dental age of that child will be 6 to 7 as per the chart which has been given by Logan and Cronfield and Lunt and Block. Okay, so this is one aspect. So this is the dental age of the child. Okay, then what do you mean by chronologic age? The chronologic age coincides with the routine, the age related to the birth date of the child, and then you calculate the years. Then there is something called as mental age of the child. So mental age will help make you discuss or talk. The method of communication, the words that you use will be depending on the level of understanding of the child. Okay. Then there is something called a skeletal age also. Okay. This is related again to the growth and development. So this way, different ages are also there, and pediatric dentistry in everything is done based on the age of the child. Is it clear to all of you? It's an age-defined specialty. So the beauty of the definition given by AAPD, it generally covers a lot of things mentioned by the other definitions also. The other definitions have also mentioned these things more or less. But the most beautiful aspect is that it is mentioning that it is an age-defined specialty. Now we go to the basic introduction. What do you mean by pedodontics? Now pedodontics is derived from a Greek word. Okay, pedo or pious means child, and dontics is the study of teeth. So pedodontics is study of children's teeth, basically. Okay, or work related to children's teeth. Now this warning has been observed at many places in the initial years, long time back, of course. There was a time when the dental clinics were biased against this specialty and considered it as a waste of time, and often clinics displayed no treatment for children under the age of 12 or 14 or 10 at this clinic. Now, why this? Why did a person who is managing adults or young adults or old patients not wanting to teach children? Because children are so nice and cute. They are wonderful. I mean, they are so best to communicate. They're so enjoyable. So they're so much fun to work with. Is it? I mentioned in the beginning only, sometimes even to just check which teeth, just to have an intraoral examination, it might take half an hour to 45 minutes. It might take half an hour to just make the child sit on the chair and open his mouth. Forget about the treatment aspects. Okay, plus the child moving. That also is another problem. Plus the parental involvement. Okay, because sometimes the parental involvement is so much that the dentist finds it very difficult to manage the child. Do it slowly. I think he's feeling hurt. I think this. I think that. And children genuinely can drive you crazy. They are wonderful. They are God's best creation, but they can drive you crazy. And that's the reason majority of dentists don't like to treat it, because they consume a lot of time. When you're treating kids, time can just fly away. Sometimes it might take you 1 hour, half an hour, 45 minutes to just do one simple restoration. In adults, you can do 2, 3 implants in an hour. So sometimes the dentist starts calculating the economics also related. That I can manage 2 adults, or I can do 2, 4 implants in 1 hour. In a child, if I work for 1 hour, at times I might be only able to do 1 or 2 restorations. So sometimes it's the economic aspect also. And the other aspect is people, the parental aspects and views. Everybody, Baba, it's milk tooth, it's going to fall. So what's the use of doing any treatment? Just give some medicines and we'll go away. So parents also at times, because of their lack of understanding and knowledge, they ask for such options. Baba, first give us medicines and then we'll see later. It's going to fall only now. Why you want to do a root canal? Why you want to give a cap? Why you want to do this? Why you want to do that? So lack of information from the part of the parents. Also sometimes, makes the dentist okay, yeah, let it be. And they send away the patient. But today dentistry has progressed. People have started to realize, because many a times some problems which have been seen in adults, the reason has been in the childhood. Many times you will see, get the adult dentist, I wish, this treatment was done, then we wouldn't have had any problem. Say, for example, I'll give a simple example. Now, suppose there is a time schedule for the eruption of all teeth, and there is a time schedule for falling of all the teeth. Now, suppose you've extracted 2 or 3 teeth or one tooth before time because it was badly carious, and you don't put something called as a space maintainer to hold that space. So what happens? The moment you have removed the tooth, the neighboring teeth move, and the permanent tooth doesn't erupt in its original position. It comes crooked, or it comes from some different direction. So then that causes a lot of malocclusion. So in these situations, it becomes very, very difficult. So that's the time especially the orthodontists are, you should have put a space maintainer 3 years back. Then this problem would have much less. That is one aspect. So now people have started to realize, okay, like the basic growth and development also can get hampered. Because see, understand one thing, milk teeth are very, very important. They're God's creation. I mean, if you ask me what is the function of teeth, are they important or not? Yes, they're very important, right from eating, that is mastication. They play a very important role in the aesthetics also. They play a very important role in the growth and development and overall development of the child. So absence of teeth, overall development also might not take. The child is not able to chew properly, eat properly. Digestion will be affected. So slowly, all these effects have been studied, and the impact has been noticed. So now everybody is aware that we need to show the dentist. Okay, and now people have become further advanced. They want to show the pediatric dentist. So now that's why there is a big, discussions going on, especially now that, when we should get the child first, when should be the first dental visit. I'll be having a lecture on the importance and significance of the first dental visit. Now, people have understood that we don't have to visit the dentist only when there is pain. We need to visit much prior to the pain, because preventive dentistry also has been stressed a lot. Now, we'll go a little bit into the history and evolution of pediatric dentistry. Okay, how did it originate? What all the things that happened? Now, this I will be covering in the second part of my lecture. Thank you so much for your valuable time. And if you have any queries or anything, please keep me posted. Thank you.